Welcome back, friends. So we are done with the osteology of thigh bone, that is femur. So now we are entering the leg region. So in the leg we have two bones, medial bone and the lateral bone. Medial bone being tibia and the lateral bone being fibula. So in this session we are doing the osteology of tibia. So let us begin. Tibia. The tibia is synonymous, or it literally means shin bone. Now this is the second largest bone. The first largest bone is your femur. This is the second largest bone in the whole body. First being your femur, and it is a medial bone of leg. And this tibia is also called as developmentally the preaxial bone. Preaxial is the bone belong to the greater toe side, and it is homologous to the lateral bone, and that is the radius of forearm of upper limb. The function of this bone is to transmit the weight. So weight transmission from the upper bone. So upper bone is femur. So weight transmission from femur will come to the tibia, and from the tibia weight will go to the foot. So it is a intermediate bone which is transmitting the weight from the femur to the foot. And this is an example. This is an example of a typical long bone. A typical long bone definitely will be made up of three parts. So it has got an upper end, shaft, intervening shaft, and a lower end. Upper end, shaft, and the lower end. Now upper end is expanded in this case. So it is upper end is expanded. So I'll bring the image also. Okay. So this one is our anterior view, and this is the posterior view. So this is the thicker bone is here, tibia, and the lateral bone, which we will do in the next session, is fibula. So this is the posterior view of tibia again, and this is a posterior view of fibula. So we are talking about upper end. So these are our upper end, and these are the lower end, and in between the entire portion is what we call as a shaft. Now we are seeing the upper end. The upper end is expanded. It is wide. Upper end is expanded, and it is bearing the condyle. So on the top, if you see here, it bears the condyle. So this entire region, this part and this part, they are called as a tibial condyle. So it is expanded, and it bear prominent medial and lateral tibial condyle. So it has got medial condyle, lateral condyle. So two condyle are there. Put together your condyle. Along with this, the upper end is also bearing. Here you can see this entire portion. This is what we call tibial tuberosity. So you also have tibial tuberosity in the upper end. So these are the parts. So upper end is expanded. It bears a large medial and lateral condyle along with the tibial tuberosity. So if you notice here, in this case we can make out that the medial condyle is larger than the lateral condyle. So medial condyle is bigger than the lateral condyle, and both these condyle will articulate above with the respective femoral condyle. to form your knee joint. And next, that is about upper end. Next is the shaft. So shaft is intervening between both upper end and lower end, and it has three borders. It has got three borders and it has got three surfaces. The borders are anterior border. So in this case, this border which you are seeing, which is going in the front all the way, detail will talk, that's an anterior border. You also have medial border. So medial border, this side is a medial, this is lateral, because fibula is lateral bone. So this border what we are seeing. So this one is a medial border. And then there is a lateral border. So definitely on this side, sorry, this is a lateral border. So these are your three borders, and if you put this, cut the bone transversely or horizontally, you will get the borders. So in the front you got your anterior border, and on either side you got, one side you have a medial border, another side you got the lateral border. Surfaces are again three. Between your, so the surfaces are, three surfaces are there, again medial surface, lateral surface and posterior surface. So in this figure, if we use again this diagram, if we see, between anterior and lateral you got the lateral surface. In anterior and medial you got the medial surface. Between medial and the lateral you got the posterior surface. Let us see the surfaces in this. So this one is our medial, this is here, because this is our anterior and this is the medial. So in between you got your medial surface. Same way, this entire thing is the lateral. So this one is your lateral surface between anterior and the lateral border, and this entire thing what you are seeing back is the posterior surface, because this side you got your lateral border and this side you got your medial border. So between medial and lateral you got the posterior surface. Now about the lower end. If you see the lower end is small compared to the upper end, and it is bearing a small projection on the medial side, and this projection is what we call, the projection is medial side and it is going inferiorly. This projection is called as a medial malleolus. The subcutaneous, we can feel this in our body, in the leg also. So medial malleolus is on the medial side, it is a projection going inferiorly. So this is all about the lower end. Now, knowing in brief about upper end, shaft and the lower end, we can decide now the side determination and anatomical position. See, anatomical position and side determination. Okay, so in order to decide the side of the tibia, we have to hold the bone vertically in such a way that, so hold the bone vertically in your hand in such a way that the expanded end is your upper end. So this expanded end, which is we are calling upper end, with the condyle should face upward. So your expanded upper end, and how do we know which is upper end? It is expanded, it should face upward, the condyle should face upward. Then you have a tuberosity, this elevation which we call as a tibial tuberosity. Now this tibial tuberosity, and along with this the border which is running down, this we call as the anterior border, also called as a shin border. Anyways, so both, so anterior tibial tuberosity and anterior border, both should face anteriorly. So second point, your tibial tuberosity and the anterior border of the shaft shall face anteriorly. So if you, this is the second part, and the third part is the lower end part. Now one end from the 2 point from the upper end, tibial tuberosity and expanded end. Tibial tuberosity facing anteriorly, expanded end present above facing superiorly. In the shaft you got the anterior border which is facing anteriorly. The lower end is bearing a projection on the medial side which we call as a medial malleolus. So medial malleolus facing medially, malleolus. So that is the third point. So your medial malleolus should be on medial side. So if you keep this three features, you will be able to decide the side and the anatomical position of the bone in the body. Now let us talk about what are the bony features and the muscle and the ligamental attachment, features and attachments. Now here you got three, so we said we will talk about upper end, then we will talk about shaft of tibia, then lower end. So I told you upper end you have two things are there, one are called as a condyle, tibial condyle. So in detail we'll study about tibial condyle. So one is on the medial side, you call medial tibial condyle, other is on the lateral side called lateral tibial condyle. So we'll study in detail about these two condyle. The second thing we'll learn in our upper end is your tibial tuberosity. So these are the two things we'll learn in the upper end. In the shaft, we'll talk about all the three borders, that is anterior border, your medial border and your lateral border. All these borders will see the extent of these borders, and we will also talk about the surfaces what we have on this shaft. Three surfaces are there, the medial surface, lateral surface and posterior surface. So we'll talk about the features and attachment of this, features and attachment of these surfaces on the shaft. On the lower end, we said lower end again we'll talk about the different surfaces. Lower end also has got 5 surfaces are there, and one of the surfaces bearing your medial malleolus. So there are 5 surfaces are there. We'll talk about all those 5 surfaces and about the medial malleolus and what are the structures attached to it. So this will be the plan of osteology of tibia. Let us start with the upper end. So now we'll do the upper end is very important, and this can be asked even in the exam, and understanding upper end will help you to understand the knee joint question also. So pay attention. Now let us talk about the upper end. So okay, so this is your superior view of your upper end. So before I go there, let us start with this only. Okay, so what do we have? So upper end presents your condyles. 2 condyles are there. It is your medial and lateral condyle, and between the 2 condyles, so this one is your medial condyle and this is your lateral condyle, and between 2 condyle you see that elevated area. This elevated area is called intercondylar area. So in between, it is called intercondylar area. So we'll study about the condyles, we'll study about this intercondylar area, and then we'll talk about this tibial tuberosity. So these are the three things we'll talk in the upper end. Okay, so first in this we'll start with the medial condyle. First we'll start with the condyle, in that we'll start with the medial condyle. Now in this again, so this is your medial side, this is your lateral side. So this portion, this entire thing from here, this entire is your medial condyle. So medial condyle has got now surfaces are there. So medial condyle is, if you compare with the lateral condyle and medial condyle, so here you can very clearly make out the lateral condyle is smaller. So then you can say it is bigger. Medial condyle is bigger than your lateral condyle. And it articulate. So medial condyle of tibia articulate with medial femoral condyle or medial condyle of femur. So this is your articulation. Now it has got 4 surfaces are there. So medial tibial condyle has got 4 surfaces. They are 4 in number. The first one is the top surface, whatever you are seeing here. So this surface or this surface, what you are visible to you. So this is what we call superior upper surface. Then we have, this is the posterior view, this is the anterior view. So you also have here, if I draw it again line, this is our area which we are concerned. So this is your posterior. So you have the posterior surface, which is the view of the condyle from the posterior. Similarly, you will have anterior. So here this one is your anterior surface. And you got superior, anterior, posterior, and one more will be a medial surface. So medial is, and if I rub this one, so medial will be the one which is hidden here. So there is a one surface on this side. So that is a medial surface. In the app I will show you these all surfaces by rotating the bone. So you got superior on the top, anterior and posterior in the front and the back, and medial on the medial aspect of the bone. So these are the 4 surfaces are there. One by one we'll see in detail all the surface. So first let us talk about the medial condyle superior surface. Now superior surface, so for this we use this image, exclusive image. Superior surface is very important. Now, so superior surface, if you see, so here you can see, here you can, this is where anterior is in the front, this is the anterior, and this is posterior in the bone. And here also you can see with the attachment, this is anterior and this will be posterior, and we are seeing from the top view. Okay, now superior surface is here. Remember we told the medial side is bigger, medial condyle is bigger than the lateral condyle. So if you see this condyle and this condyle, you have to find out which one is bigger. So that is one way. Otherwise you look at the medial malleolus and go up and you find which is a medial. So superior surface, here it is smooth. The feature of the superior surface, it is smooth, and it is oval. So if you observe both of this, oval will be, your anteroposterior diameter should be more than your transverse diameter. So that is how you call as a oval. So smooth, oval, and definitely it is articular. It is covered by your hyaline cartilage, so it is articular. It articulates with the femoral condyle. Now if you see in this, this is the one, this is our medial condyle, because this is more oval, in shape than the transverse. So it will, this is the one which is articulating. So here also this is your medial condyle. That is, if you see in the central part of it, if you see the central part, this is the central part, or this is your central portion, this one. The central part is concave, whereas the peripheral portion, this peripheral portion is outside this. This is the periphery. So this peripheral part is flat. The central is concave and the peripheral part is flat. Now this peripheral part which is flat, this will give attachment to a cartilage, a fibrocartilage, a type of a cartilage called fibrocartilage, and that fibrocartilage is what we call as a meniscus. So meniscus is attached to this peripheral flat area. So here in this above picture you can see this is the meniscus. Since it is present over the medial condyle, you call this as a medial meniscus. So medial meniscus is attached to the peripheral part. You can see the central part is still unoccupied. This is your central concave part, whereas the peripheral flat part is occupied by a fibrocartilage called as a medial meniscus. And that's it all about your superior surface. Now let us talk about the posterior surface. Posterior surface of your medial condyle. So for posterior surface, we will go and take this bone again. So okay, so now in this, the posterior surface, if you notice, so this one is, we are calling this as this is our posterior view, this is our posterior view, and this is our anterior view, and this is a tibia, and this is a fibula. So the posterior surface, this is the part here we are noticing. Here posterior surface bears a deep groove for the insertion of a tendon of semimembranosus. Now in this picture, this is your medial condyle is this one, this is your lateral condyle. So this is our area we are talking. So this is the area. So here you will have a groove which is meant for insertion of tendon of your semimembranosus. Now semimembranosus insert into the groove. So a deep transverse groove is present here. Another picture. So this is one more picture. Here you can see this is our posterior view, and here this blue area what you can see, this is the part. Now this one is your insertion of your semimembranosus muscle. So that's about your posterior. So superiorly you saw the menisci was there and the hyaline cartilage was attached, and now posteriorly you have only one thing and only one muscle, that is semimembranosus muscle in the transverse groove. Next, anterior and medial surface together, the features are same, so together. So the anterior medial surfaces of your medial condyle. Now to see this again, you'll get this picture. So here you have, okay, so this picture I bring it here, and in this case, so this is our anterior surface, anterior, and medial will be this side, or even this side is your medial. In the app you will be able to see both. So anterior and the medial surfaces of this, they will have so many, if you can notice, there are so many tiny foraminas are there. So it is occupied by so many vascular foraminas through which your vessel will be entering and leaving. So it is occupied by vascular foramina, and the margins of this, you can see this is the lower margin and this is the upper margin of both, will provide attachment to your aponeurotic extension of your vastus medialis, called as a medial patellar retinaculum. So medial patellar retinaculum attaches to the margins of your, that is upper and lower margin of your anterior and the medial surfaces of the medial tibial condyles. So these are all the surfaces of the medial condyle. So let us go to the app. So the app now will try to see these things again. So we will see now all the menisci, that is your first again surface by. So okay, so now we are concerned with our this bone and we need only tibia. We can hide others, and okay, so that's a bone. So here if I would like to give you some details, here this area you can see that's your upper end, which is now, and this upper end, let me turn the bone, this entirely is your upper end, and upper area what you are seeing, those are articular condyle. This blue color now became pink. This is your shaft, you can see all around, that's a shaft, and this portion, small narrow area with the projection going downward on medial side, that is your medial one, that is your lower end. So these are your three parts. Now if you see some surfaces and all which I was mentioning, so if you see now, this one is your medial condyle of tibia. You can see this is anterior, this is the medial, this is the anterior surface in the front, this is the medial surface entirely, this is a posterior surface here, and on the top is a superior surface. So anterior, medial, posterior and superior. So those are the surface of the same thing. If you see on the lateral, so lateral condyle of tibia, this is your anterior surface, this will be the lateral surface, this is the posterior surface, and this is your superior surface. So these are the, so anterior, lateral, posterior and superior. Difference is for medial condyle it is medial surface is there, for lateral condyle lateral surface is there. Now both these condyles are now on the superior surface. If you notice, they both are separated. So you can see upper end you have got condyle, intercondylar area and the tuberosity. So this we have seen, this yellow and pink are your medial and lateral condyle. Now intercondylar area is present on the superior aspect. So this red part which I am now highlighting, now this became pink. Now this is what we call intercondylar area or intercondylar eminence, because it is present between both the condyle. Now this area, that is your tibial tuberosity, which is green in color now, leaf green. Those are your different parts are there. Now if you notice, in front of your red area, that is red area is your intercondylar eminence, this we call as a your anterior intercondylar area, because it is lying in front of the intercondylar area. Same thing you will call this one as a posterior intercondylar area. So these are the parts. Okay, now let us go to our medial. So medial condyle we were doing the superior surface. So superior surface we said it is bigger than the lateral. So you can see here medial surface is smooth, it is flat, the central portion is concave and the peripheral is flat, and here it is giving attachment to your menisci. So let us put the menisci. Yeah, that's your menisci on top of it. So this is your medial meniscus. It's a fibrocartilage. If you isolate this, or if you, yeah, this is the one. You can see this is the medial, entire thing is there. Okay, so this is about your superior surface. At the periphery it is present, it's a fibrocartilage. No, that was about the superior surface. Then we also mentioned the posterior surface. So let us go behind now. Posterior surface, let me hide this. So posterior surface. So this is your posterior surface here. Posterior surface bear a deep groove. Now to see the groove, that's a deep groove what you have. This is the one, transverse groove, the pink color. Now a semimembranosus is attached here. So if you see here, now that's a muscle, you can see entire muscle semimembranosus is attached to the posterior surface of the medial condyle of the tibia. Remember this muscle, we have done this muscle in the ischial tuberosity, semimembranosus muscle, crossing the knee joint and going down there. So that is your muscle in the posterior. And then we looked at the anterior. So if we come back here, so this is your anterior and this is your medial. So anterior and medial, we said it will give attachment to your two retinacula, we said, and the retinacula is a extension of your vastus medialis. Now you can see here this part. So this one is what we call as this one. So this is your medial patella retinaculum, extension of your vastus medialis, that is to the anterior and the medial surface. So this is all about your surfaces of medial condyle. Now let us go to the next surface or next condyle, now lateral condyle. So lateral condyle also got surfaces are there for lateral condyle. It is same, only thing is instead of medial you will have the lateral. So let us put the bone here, and the surfaces are again, remember the lateral condyle is, it is smaller than the medial condyle, and this will articulate with your lateral femoral condyle. Okay, so it also present superior surface, which will be on this side. This is the superior surface, and there will be posterior surface. So this is your posterior is back side. So this is your small area what you are seeing, where I am writing P is a posterior surface. Then there is an anterior surface in the front, because this is an anterior view. So here you can see this area is your anterior surface. So it is your anterior surface, and this side, which we are not able to see in the app, we have seen already, that's your lateral surface. So there are 4 surfaces are there. And if you see the superior surface first, the superior surface of your lateral condyle. Let us bring this image back here again. This is your superior surface. So superior surface is again, this also is smooth. It is articular because it articulate with your lateral femoral condyle. And just like, and there it was oval, you see here this was oval in shape, but here it is, you see they are more or less same in comparison. Here you can see this, here you will get the circular, so thereby you can see the lateral one is circular in shape, whereas the medial one is, this is oval in shape and this is circular in shape. So circular. Okay, so now just like we have seen in the medial, the lateral one also, the central part is concave, whereas the peripheral part is flat. So peripheral part, this is your peripheral part which is flat. This is central part which is slightly concave. Now this peripheral flat part is covered by again a plate of fibrocartilage, and that fibrocartilage is what you call as a, again same name, meniscus. Now since it is present on the lateral condyle, it is called as a lateral meniscus. So here you can see this is your lateral meniscus, this entire thing what you are seeing, this is our lateral meniscus. and this is covered by your hyaline cartilage. So this is about your superior surface. So superior surface is all about your lateral meniscus. Next is posterior surface. The posterior surface of lateral condyle. The posterior surface of lateral condyle. For this again, so here we have, again we'll take this image, and I said this is our posterior view. So posterior surface of lateral condyle is this one. So what you will notice here, inferiorly and laterally. So this is posterior. So little inferior, little laterally. Here you have a facet. You see here, there will be one facet is there. So here you will posterior surface more so on the infrolateral aspect of posterior surface. So infrolaterally on the posterior surface, it presents a circular smooth facet is there, articular facet. And this articular facet is meant for your head of fibula. You can see the head of fibula is actually making a joint. So this is forming superior tibio fibular joint. That's about your superior tibiofibular joint with the head. And between the articular facet for the fibula and the margin of the superior surface, there is a shallow groove. So here the groove we are not able to make out. In between these two, there is a groove is there here. Now this groove, which is present between the facet and the margin, this is the groove for tendon of Popliteus. So tendon of Popliteus passes through this groove on its way towards its insertion. I'll show there in the app again. So as far as the posterior surface is concerned, two things. One is your head of the fibula articular facet. Other thing is a groove for the tendon of Popliteus. So this is your posterior surface. Then next two are together again, anterior and lateral surface. Anterior and lateral surfaces of lateral condyle of tibia. So put this back here. So here this is the anterior, here this is here anterior, and here is the lateral. Now if you observe the anterior surface, one thing you can very clearly notice here, especially in the anterior surface, if you can follow this, there is small impression can be seen. So that is a small flat triangular area is there. Flat triangular area in the anterior surface. Now this flat triangular area or the facet is for the attachment of your iliotibial. It is a lower attachment of your IT band or iliotibial tract. So ilio is from the iliac crest, tibial is to the tibia. Which part of the tibia? Upper end of the tibia. In which part of upper end of tibia? Lateral condyle of tibia. In which part of the lateral condyle of tibia? It is the anterior surface of lateral condyle of tibia. Now this area, it is little elevated, so it is also called as a tubercle. It is also called as a Gerdy's. It is also called as a Gerdy's tubercle. So Gerdy's tubercle is a flat triangular facet present on the anterior surface of the lateral condyle of the tibia, and it allows the lower attachment of the iliotibial tract. So that is about your anterior surface. Rest of the anterior and lateral surface, just like there, rest of your anterior and lateral surface, both these are providing attachment to your lateral patellar retinaculum. Just like there you had medial, here you got lateral. So here you have two things. One is here flat area providing attachment to iliotibial tract, another one the lateral patellar retinaculum. So superior surface, you got the lateral meniscus mainly. Posterior surface, you have a facet for the head of the fibula and the groove for the tendon of Popliteus. And the anterior surface, you got the facet called Gerdy's tubercle for iliotibial tract, and both anterolateral surfaces are providing attachment to the lateral patellar retinaculum, which is the aponeurotic extension of vastus lateralis. So let us see in this. So this is the lateral side is this side. So first lateral side superior. So we have to look at the menisci. Now you can see the superior surface. Now this is the one. This is the ligament. You can see this is your fibrocartilage which is present on the top of it. So this is superior surface menisci. Now rest of the thing. Now after this, if you move to the posterior surface, now see, if you see posterior surface, again near infrolateral area you see there is a facet is there, a smooth facet, this one, or the green one. This is a facet for your head of the fibula. So the head of fibula will articulate here. So if you want to see, so I can put the bone back in this place. So that is where the head of the fibula is articulating, forming a superior tibiofibular joint. Okay. Next, we also have a groove now. We mentioned that there is a groove for your popliteus. So this is here the groove is not shown. Possibly I can use the pen, or if I show you the popliteus muscle, then you will be able to. So if I show the popliteus muscle, now you can see here. So this area is the groove into which the tendon of popliteus is lying. So you find the groove for the tendon of popliteus there. This is, so laterally you will see facet for the head of the fibula and the groove for the popliteus. Now come anteriorly. If you see anterior aspect, this one is your impression for your, you can see this is your iliotibial tract, extending from the ilium all the way, from the iliac crest, goes all the way down on the lateral aspect, comes and insert here, you can see, to your Gerdy's tubercle or the anterior surface of lateral condyle, and this is what we call as a here anterior surface. So this is Gerdy's tubercle. Next is one more is there which I forgot to mention there. The small, this is a origin of your extensor digitorum longus muscle. So there is a muscle. You can see this muscle is a long muscle. It goes down. It helps in the extension of your digit, extensor digitorum. All your digit, all lesser toe, second to fourth toe, you're moving upward. When you're walking on a wet floor, how you will lift all your toes. So they all are done by this. So muscle takes origin from so many different places. This is the highest origin from the lateral condyle, from the lateral surface, you can see, or you can simply go lateral condyle. This I forgot to mention in the when I was doing there. Okay. So rest of the part is giving attachment to, we said, is your retinaculum. So this is here lateral patellar retinaculum to the anterior and the lateral surface. So this finishes here medial and the lateral condyle. Now if you go here, we are doing the upper end. In the upper end, we said we'll be doing, this is the upper end slide. So in this we are done with the condyles, both medial and the lateral condyle we are done. Now we'll go to the intercondylar area. So let us talk about the intercondylar area. Next is intercondyle. There is an area between the two condyles. So intercondylar area. It is also called as a intercondylar eminence, projection eminence between the two condyles. So it's a rough area on the superior aspect of the upper end of the tibia between the two condyles. If you see this here, so the area is rough because the rest of it, if you see, this is medial condyle is smooth, superior surface, lateral condyle is smooth, superior surface, but in between these two, this area if you are seeing, which I am marking with the blue now, the entire thing, this part, is what we call intercondylar area. So this area is rough. It's a rough area located on the superior surface. Location, rough area, location, superior surface of your upper end of tibia, because we are doing upper end of tibia, so that's why we are doing this. And where it is present between, on both the side you got medial condyle and the lateral condyle, between condyles of tibia. That is why it is called as a intercondylar. So in this also, if you notice the middle portion again, in this also, this middle portion, this part is very narrow. So in the intercondylar area also, the middle area is narrow, and here it is marked by elevation. You see, can you make out elevation? Here elevation may not be very prominent. In another image, full view if you see, you will be able to know. You see in this. In this you can see these elevation you are noticing. This is in the middle part of your intercondylar area. Now these are the elevation what we see in the middle part of the intercondylar area. So this middle part is what is narrow and it is marked by elevation. So these elevations are the medial and elevations are called intercondylar eminence. So this eminence is actually the middle part. So these are called as a intercondylar eminence. So intercondylar eminence is the middle part of your intercondylar area where you will see two projections are there. So here you have again, there is one is the medial eminence is there, other one is your lateral eminence is there. So you can call the medial side one, you can call this one as your medial intercondylar tubercle, and same way this will be called as your lateral intercondylar tubercle. So these are your two tubercles. So thereby you have an intercondylar area, then middle of the intercondylar area you got your narrow area. In the narrow area you have two projections. So these two projections together are called intercondylar eminence. So in this, the medial projection is called medial intercondylar tubercle, the lateral eminence is called lateral intercondylar tubercle. So this is about your intercondylar. Now there is an area in the front and there is an area behind. So if you see the superior view again, so in this you can make out, so this is the area which I told you as your middle part. So this one is your medial intercondylar tubercle. The same way this elevation we mentioned as a lateral intercondylar tubercle. Now there is an area behind this area behind this, and there is an area in front of this. So this is what we call anterior intercondylar area, and this we call as a posterior intercondylar area. So thereby you can say your intercondylar area is divided into a middle part. So middle part is what you are calling as a eminence. It is simply called as a intercondylar eminence, where you have two tubercle. So you call medial and lateral intercondylar tubercle. Then you have an area in the front of it, you call that as anterior intercondylar area, and there is an area behind it, we call that as a posterior intercondylar area. So this is all about the intercondylar. Now what is important is, all these three, if you come from the front to back, that is from the anterior intercondylar area and your intercondylar eminence and the posterior intercondylar area, that is from anterior to posterior, if you go, it gives attachment to 6 structures from front to back, and those 6 structures are very important from the exam point of view also. So I'll put down this picture and we'll see this, what are the 6 structures. So this is your anterior, this is posterior. If you count here, so this is your 1, I'll just counted 3, 4, 5, 6. These are the 6 structure what we have. The same 6 structure I can put down here also. So here you got 1, 2, 3, then you have 4, 5 and 6. So these are the 6 areas what we have. So the 6 structures are present from anterior to posterior. So what are these? So from front to back or from anterior to posterior, if you go in this intercondylar area, the 6 structure which are attached are, so there is a, if you notice this one we already called this as a medial meniscus, and this one is a lateral meniscus. Now if you notice the menisci, both the meniscus they have a horn. So this is what we call, because this is our anterior, the front end is called as the anterior horn of medial meniscus. Same way this back end will be called posterior horn of medial meniscus, and this also will be your anterior horn of lateral meniscus, and this one will be your posterior horn of lateral meniscus. So thereby you got 4 horns are there here. Now horns of a buffalo or something. Now, apart from that, you also see in between these horns you will also have ligaments are there. So these are your cruciate ligament. So you can see this projection. So this is your front. So here is anterior. So this is your anterior cruciate. I did this. Cruciate is the crossing ligament. We did this ligament in the femur intercondylar area. And backside you see this one posterior cruciate ligament. So these are your tibial attachment. We have seen the femoral attachment in the. So these are your. So thereby there is a anterior horn, posterior horn of medial meniscus, anterior and posterior horn of lateral meniscus, and anterior and posterior cruciate. So all these 6 structures from front to back, they are arranged in a pattern. So how they are arranged? So first you got the anterior horn of medial meniscus. This is the anterior most. You can see the picture here. So this is your anterior horn. So thereby you can call this as a, I'll use a red color. So this is your number 1, and here this is the 1. So this is your first structure which is attached from the anterior most. So this is called anterior horn of medial meniscus. Then again you go next. Immediately behind you got the anterior horn of lateral meniscus. Now you see immediately behind this, in this area if you go, you got your anterior horn of lateral meniscus. This is the one. So this one will label this as your number 2. It look like this is there, so if they are both are in the same, more or less, it is just there. So this one is your number 2. Then number 3, you got now, sorry, here it is a cruciate ligament is number, sorry, anterior cruciate. No, this is, okay, so this is your cruciate ligament is number 2. So anterior cruciate ligament, anterior cruciate ligament. So this one, so here this is your anterior cruciate ligament is number 2, and this one is your anterior cruciate ligament. This is our number 2, second in line. Now you got a anterior horn of lateral meniscus, so which is here number 3. So this is your number 3 anterior horn. Then again number 4, if you come back here, now horns are there again, back again. So you got now this time the posterior horn, because it is circular, so this horn will come earlier, and this is oval, so it will be little behind. So your number 4 is, again you can see here, this is the posterior horn. So if you start from here, your meniscus, goes all the way and it is ending here. So that is how. So thereby fourth you got the posterior horn of lateral meniscus, and then fifth you got posterior horn of, this is number 5, posterior horn of medial meniscus, and the last is your posterior cruciate ligament. So this one is number 6, posterior cruciate ligament. Now how to remember this order? So there is a simple way to remember this order, and that is a mnemonic is there. This we call as horn part is all anterior will be anterior, all back is posterior. So what we remember? M. So here you got medical, M is your meniscus, so medial meniscus medical, college, so medial meniscus, cruciate, and again here you got lateral meniscus. So medical college Lucknow, and here you have a, this is again lateral, Lucknow Medical College. So the mnemonic is, I'll use in the next page, Medical College Lucknow, Lucknow Medical College. So here this medical means it is your medial meniscus, C is your cruciate, L is your lateral meniscus. All these are your anterior. So you can see this is the anterior horn of medial meniscus, the anterior cruciate ligament, the anterior horn of lateral meniscus. Now this one, lateral meniscus, medial meniscus, and your cruciate again. So all these are your posterior. So this is the way to remember your all the structure. In the Viva they can highlight this area with the chalk paste. They'll say write the structure attached. So you have to write this Medical College Lucknow, Lucknow Medical College. It's important from the exam point of view also. So we go back here to this part, and yeah, so in this slide, so we are done with the intercondylar area also. Now the last part is there in the upper end, and that is your tibial tuberosity. So let us go to the tibial tuberosity. So with this your upper end will get over tibial tuberosity. Now tibial tuberosity can be a 3 marker. So let us put the bone picture. I can show you all this. Sorry, I didn't show you. I can show you these all things what we have seen. Okay, so let us bring, okay, these are the structures what we have, and so here, now if you label this again, so this side is your medial, this is your lateral, so this one is your medial meniscus, this is your lateral meniscus, this is your anterior cruciate ligament. What is this one? Here it is cut end of your posterior cruciate ligament. You can see this is the anterior horn of medial meniscus, then you have the anterior horn of lateral meniscus, then you got your, so this is the anterior horn of medial meniscus, anterior horn of lateral meniscus, posterior anterior cruciate ligament, then posterior horn of lateral meniscus, posterior horn of medial meniscus, and posterior cruciate ligament. So these are the structures, and if we select them, let us do multi-selection and see how all this appear. Now this one, you see how beautiful they are. So those are the structure what we have. This is a posterior, this is anterior. Look at the cruciate, the crossing of the ligament, and your oval shape and circular shape, medial and lateral menisci. Okay, that's beautiful. Okay, so now tibial tuberosity we are seeing. The tibial tuberosity is the one which is present on the anterior surface of the upper end. So this one is your tibial tuberosity we are seeing. Now, tibial tuberosity is a projection at the apex. So this is, if you see, there is a more or less a rough triangular area is coming here. So if you draw more or less here, it is a rough triangular area comes here. So it is actually forming the apex of this rough triangular area, which we call as a tibial tuberosity. Now this is dividing. So projection at the apex of the rough triangular area is present at the upper end of the tibia. So it is divided into upper smooth area and the lower rough part. Now this one you can see, this whole area, this one is, this portion if you see, this is the smooth area. So this is upper smooth area, whereas the lower rough part, you can see the smooth area and there is a rough area is there. So lower rough part is subcutaneous. So here you will have a bursa. So there will be a attachment of a bursa here, so that we call as a subcutaneous infrapatellar bursa. Because it is beneath the patella, so it is called subcutaneous infrapatellar bursa is present there. And upper smooth part, this portion will give attachment to your ligamentum patellae. We have seen that in the femur, also called as a patellar ligament. Now this apex of this itself is giving rise to, so this rough area of the apex, this will give rise to deeper to this part, give rise to another. Now this we call deep infrapatellar bursa. So thereby your tibial tuberosity is a projection at the apex of the rough triangular area. So this is all is, there is a rough triangular area is there, upper is smooth, lower is rough. The smooth area is for your ligamentum patellae, rough area is for your subcutaneous infrapatellar bursa, and deeper to this you got another rough area, that is for the deep. So thereby there are two bursa and one ligament which is attached in this. So let us see this in the app also. So here we have to bring our bursas. So okay, let us bring the bursas. You can see those are the bursa. Bursa. Yeah, so we got the two bursas here. So this is your patella, and here you have the bursa. So this is your subcutaneous bursa, and you see there is a deeper bursa, one more is there, that is your deep bursa, subcutaneous infrapatellar bursa. This one is your subtendinous, or simply you can call this as a deep infrapatellar bursa. Those two are the bursas what we have, and this area, in this part we will have attachment of your ligamentum patellae. So that I can show in the app only. Sorry. Patellar ligament. So now you can see this is, so you can see again in this picture also, we label this one, and this is here subcutaneous infrapatellar bursa, because it is beneath the patella. And this one is here ligamentum patellae or infrapatellar ligament, and deep to this, in this area, deeper to this, you have here deep infrapatellar bursa. So those are the things. And to the this is the tibial tuberosity. So the tibial tuberosity, these are the things which are attached. So you can see this entire thing is attached. So this is the area. So you can see in the smooth part, your ligament is attached. Yeah, so this is about your tibial tuberosity. So that finishes here upper end. Now let us go to the shaft of tibia. Now remember, shaft of tibia I mentioned, I told you it has got three borders are there. So there is an anterior border, and then there is a medial border. So if I consider this medial, and there is a lateral border, and there are three surfaces are there. Between your anterior and medial, you have a medial surface, and between anterior and lateral you got your lateral surface, and between medial and lateral you got the posterior surface. Now in this, your lateral border is also called the interosseous border, because the interosseous membrane attaches to this. It is also called the interosseous border. So let us see each border one by one. First we will do the borders, then we do the surfaces. Borders, in that anterior border, borders of shaft. So anterior border, so here you can notice this is the border which is going all the way. So anterior border feature is it is the sharpest border, and it is subcutaneous, you can feel it. So this is the border through which we discover our furniture. When there is a power cut and we walk around and suddenly our leg hit something tough, and it will cause the pain. So why? Because this is what is the border which is actually getting hurt. So this is sharpest border, subcutaneous border, and it starts this vertical, but as it goes down, it is making a little curve. So thereby it is also called as a, not a straight border, so it is sinus border, sinuous, sinuous, sinuous. It's like sine wave. We say sine like this. This is what we call sine wave, right? So this is sinuous in quotes, and the extent of this border above it is the tibial tuberosity. You can see it is the tibial tuberosity from where it is starting, and it goes down all the way, and here it is medial malleolus. So for medial malleolus it is becoming the anterior border. So it becomes the anterior border of medial malleolus. So this is your anterior border. Next we look at the medial border. So medial border of shaft. So the medial border, so fibula is here, so this is the lateral side and this is the medial side. So the medial border, it extends. So extent of this border from the medial condyle of your tibia. You can see here, from here it is going down all the way. It goes all the way down. If I draw this line, hopefully I should not shake. And you see it is going back. So thereby it is forming your medial malleolus posterior boundaries. The extent is from the medial condyle of tibia, that is the upper end. Lower end it is going, and it is forming now posterior border. Posterior border of medial malleolus. So anterior border was formed by your anterior border of medial malleolus was formed by your anterior tibial border. This is posterior tibial border. So this border is lengthier because your anterior border is starting from tibial tuberosity, comes down, and it is becoming your anterior. So that was your anterior border, and this is your medial border. Now this medial border, if I just turn it slightly, you will notice that there is a line called as a soleal line, which we'll see in the posterior surface. It joins the medial border at the upper 1/3 and the lower 2/3 junction. So for this, maybe I can bring this picture, and in this you see, so this one is your posterior view of medial border. This is a posterior view, and now you see there is a soleal line. I'll be talking in a while. So you see soleal line. So it is meeting the soleal line, the junction of upper 1/3 and here lower 2/3. So the meeting is happening at this junction. So we say the soleal line joins the medial border at the junction of upper 1/3 with the lower 2/3. So that we can only see here, this part of it. So that is about the medial border. One is the extent, another is the meeting with the soleal line. Next is your last border, lateral border, and I told you lateral border can also be called as interosseous border because it gives attachment to interosseous membrane. So here is your lateral border now. So now the lateral border is, again this is sharp, not as sharp, but it is a sharp border. Again the second sharp border because interosseous membrane attaches here, and the extent, again if you see, it is from the lateral condyle all the way below the facet of the fibula. So here you got the facet for the fibula, this one. It is below the facet of the fibula. From there it is going down now and keeps on going down, and it becomes the anterior border of a notch. Here you see there is a notch here. So this notch is what we call as it is a notch for the fibula. So we call this as a fibular notch. In the lower end we'll talk about this. So the fibular notch of tibia. So the border is extending from the lateral lateral condyle of the tibia below the facet for your head of the fibula, goes all the way down, and when it comes to the lower end, here it is becomes the anterior border of your notch, so fibular notch of the tibia. So extent is from your lateral condyle of tibia, and below it is here the anterior border of fibular notch. It's a triangular notch like this you will be having. This we call anterior border, posterior border. Okay, and this border throughout it extent, it is providing, you can see in this one. So this is our border again. Sorry, I just lost this thing. And this is providing attachment to the interosseous membrane. So interosseous membrane attaches to this border. You can see this is the interosseous membrane here. Throughout it extend, it gives attachment to the interosseous membrane which unite tibia and fibula to form middle tibio-fibular joint. Now when you come here in the lower part, here the lateral or interosseous border, it is dividing. So I'll show that in the app again. It comes down like this and it divides. So it encloses, it divides. So that means this border come down and it divides into two parts. So this we call as your anterior part, and this is the posterior part. And in between it is enclosing a triangular area. This triangular area is what we call as this is your notch for the fibula. So you can just simply call this as a fibular notch. So fibular notch. So distal part divides to enclose a triangular notch, and this is here we will have the attachment of this area will provide the attachment to your interosseous, not important this one, inferior tibio fibular ligament. Okay, so So inferior tibiofibular ligament is something. This is your tibia and this is the medial malleolus. Similarly, you will have here fibula and this is the lateral malleolus. So here in between these two, here you will have a ligament here. So this ligament is what we call as a inferior tibiofibular. So this is the one which is actually, this part is attached to this one, what is it? Okay, well, I'll do this again when we do the ankle joint, but if you can remember this, it is fine. So these are all the borders. Now next, I'll show the borders here in the app now before we go to the surfaces. Okay. Okay, so in this one, the pink line is your anterior border extending from your tibial tuberosity all the way to your anterior border of your medial malleolus. Now we go back. Now this one, this is your medial, that's a medial border extending from the medial condyle of tibia and forming the posterior boundary of your medial malleolus, the orange color. And this side if you go, and this one is your lateral border extending below your facet for the head of the fibula from the tibial condyle all the way. You see here it comes down and it is dividing into a triangular notch, and that is your fibular notch. So these are your three borders. Now let us talk about the surfaces now. Surfaces of shaft of tibia, and we said there are three surfaces are there here again. So first is your medial surface. Let us talk about the medial surface. Remember the surface I told you, medial, then you have the lateral and the posterior. These are the three surfaces. Let us talk about the medial surface. So medial surface is between, this one is here, I am only draw a part of it, anterior border, this is the lateral border. So this is the medial surface. So we can say medial surface, it lies between the anterior and medial. Easy way will be again to draw the triangle. So this is the anterior border, medial border, lateral border. So this is the surface, is your medial surface between anterior and the medial border. Now this surface, if you see, this surface is entirely subcutaneous. This surface also we can feel in your leg. You just trace the finger, you will be able to feel this part of the bone. So it is almost entirely subcutaneous from the knee joint till your malleolus or till the ankle. Now in the upper part, so in this area, in this upper part, it receives the insertion of three muscles. So three muscles are inserted in this part. And what are these three muscles which we receive? Here there is a sartorius, anteriormost muscle is sartorius. Then behind two muscles are there. One is called gracilis, which is above. Another one is below, called semitendinosus. Membranosus was behind. This is tendinosus. So mnemonic to remember this will be girl between two surgeons. So girl between two surgeons. So two surgeons are here, sartorius and semitendinosus. Girl is the gracilis. Now I'll show you the image here. So here you can see, so inverted hockey, this first one is your sartorius, and then upper one is a gracilis, the lower one is your semitendinosus, and all these are separated from each other. All the three tendons are separated from each other by a bursa. So there is a bursa which separate all these three muscles from each other. That bursa is called as a Ansarine bursa. Ansari bursa. And that bursa get inflamed, we call that as Ansarine bursitis. Now all these three muscles together are called as a gyrope muscle. Gyrope muscle. Why and all I'll do it in the detail when I do the compartment. Right now remember, gyrope muscles are these three. Ansarine bursa is the one which is separating these three muscles. So let us see these muscles in the app now. Now here is our muscle. So this one is your sartorius. So isolate and see, that's your sartorius. You can see coming from anterior superior iliac spine, longest muscle coming in, attaching here. Then next muscle, I'll hide this. Second muscle, posterior, this is gracilis. Again coming from your body of the anterior surface of the body of the pubis and from the inferior ramus or conjunctival pubic rami. This is the gracilis. And you have one more last muscle. This is called semitendinosus. And this muscle comes from your ischial tuberosity. You can see there. Ischial tuberosity comes down and attaches there. So all these three muscles are attached in this area, and these are called gyrope muscles. So rest of the, you can see the rest of the surface. You see only this area you got the muscle. These are the three muscles which are attached. The rest of the area, you see, entire area is subcutaneous. That is why we say almost entirely this surface is subcutaneous surface. Only in the upper part you have the muscle, rest of it you can feel the bone. So sartorius, semitendinosus and gracilis. Now let us look at the lateral surface. Now let us look at the lateral surface. In the lateral surface, again if you draw this is the anterior border, medial border, lateral border. So medial surface was between your anterior and the medial border, so lateral surface will be between the anterior border and the lateral or interosseous border. Now this is again, if you bring this in this image, I can show you the lateral surface. So here is our anterior border, this is a lateral border, so in between is your lateral surface entirely. I am just marking only a part of it. That's a lateral surface, the whole of it. The cross mark I am putting, the entire thing is your lateral surface. Now this lateral surface is, it's provide origin or attachment to in its upper two-third to a very important muscle called as a tibialis anterior. Now you can see here in this. So that's your tibialis anterior. Tibialis, because it is from tibia, anterior because it is in the front of the tibia. So tibialis anterior is taking origin from your lateral border, lateral surface. From which part? From your upper, from the upper two-third of the lateral surface gives origin. So there is origin even from the interosseous, corresponding part of the interosseous membrane also. And if you see the lower one-third area, the lower part, if you notice here in this part, it is subcutaneous, but mainly in the lower area here there are so many structures which are crossing. There are structures which are crossing. So what are these structures which are crossing in the lower one-third area from medial to lateral? So medial to lateral, if you go, there are structures which are crossing, and these are the structure which are leaving the leg and entering the foot, and they will be compressed by a retinaculum. So there will be a retinaculum here called as extensor retinaculum. So these are the structure under the extensor retinaculum. So medial most is here, tibial is anterior. I'll show this all in the app also. Tibial is anterior, extensor, hallucis. Hallucis is for your great toe, just like pollicis is for your thumb. So it is a muscle acting on your great toe. Longus, because there is a brevis also is there. Then you have an artery called as an anterior tibial artery. All this you will know once we do the compartment. And there is a nerve called as a deep peroneal nerve. So tibialis anterior, extensor hallucis longus, anterior tibial artery, deep peroneal nerve, and then extensor. So this is for your great toe, and then for the remaining two, extensor digitorum longus. And then finally you have one muscle called as a peroneus tertius, Tertius. So you can see here, you can identify some of the structure here. So this one is your, these are your retinacula, what you are seeing. Anyways, our concern is to identify this one. This is your tibialis anterior tendon, and after tibialis anterior you see another tendon which is going to the great toe. You can see that is the second one. This is called extensor hallucis longus because it is going to your great toe. You can trace it and see where it is going. And next to that you see there is an artery is there, red color. So this we call as a anterior tibial artery. So here you see this is the anterior tibial artery, and then next to that there is a nerve is there. That nerve is called deep peroneal nerve. Later we'll see why it is called so and so. And more laterally if you come, again there is a tendon is there which is coming down and dividing into, you see there are four tendons are dividing for all the four lesser toe. So this is extensor digitorum longus, and more lateral to it. Here it is again not shown. Here it is missing. Possibly this is the one. Yeah, this is your peroneus tertius. So these are all the structure which are passing from medial to lateral in your lateral surface in the distal part. So that finishes your lateral surface. So let us see this in the app also again. So which is our, this is our lateral surface. Now you can see this is the muscle I was telling. So this is your tibialis anterior. You can see it is all the way from the 3/4 lower part. You see lower part it is subcutaneous. Tendon goes all the way down. Where it is inserting we'll see later, that is tibialis anterior. Now other than this, we said in the lower part there are so many structures are there which are crossing. So what I can simply do is I can add the muscles here. So these are the muscles which are added, and in this I can add artery also now. So that is artery. I can add nerve also. Okay. So again if you see the name appears, that is tibialis anterior. Isolate as tibialis anterior, or I can hide one. Then after tibialis anterior you got this one which is going to the great toe, that is your extensor hallucis longus. This also will hide. Then after that you have an artery. You can see this is the artery, anterior tibial artery, hide. And after that you have a nerve, that is a deep peroneal nerve, also called fibular nerve, hide. Then you got your extensor digitorum longus which is going to the remaining 4 toes, hide. And then you have a small muscle here again, that is your peroneus tertius, also called fibularis tertius, right? So these are, you see, now this entire area is visible. So if you unhide all those things, you bring it back, you see the entire part will be slowly, you can see it is again covering. So entire lower 1/3 of your lateral surface gets covered with these neurovascular structures. Okay, so that's about your, not able to bring it in this. Yeah, one more thing. Yeah, so these are all, everything covers. So these are the, so there is a mnemonic to remember this also, that is mnemonic to remember this is here, All this we remembered by a mnemonic, and then are not dry plateaus. So D for tibial is anterior, H for your extensor hallucis longus, A for your artery, anterior tibial artery, N for the nerve, that is deep peroneal nerve, D for your digitorum, extensor digitorum, and P for your peroneus tertius. So these are, this finishes your lateral surface also. Now we have last surface called posterior surface. So posterior surface of shaft of tibia. Again put this picture like this. This was anterior border, this was your medial border, lateral border, this was your medial surface between these two, this was your lateral surface, and between your posterior medial border and the lateral border you got the posterior surface. So posterior surface lies between medial and lateral border, that is a location, and so this one, yeah. So this is the posterior surface we are seeing. Now the posterior surface, there is a bony ridge in the upper part. You can see there is a bony ridge here. If we had a bone in our hand, with this we cannot miss. There is a bony ridge in the upper part of the posterior surface. So this bony ridge we already told, it is actually cutting your medial border at the upper 1/3 and the lower 2/3 junction. So this ridge is what we call as a soleal line. Soleal line. So soleal line is a bony rough ridge which is extending from, here you can see it is extending from the fibular facet for the head of the fibula. So extend from the fibular facet till the junction between the medial border of upper 1/3 and lower 2/3. That is the extent of your soleal line. So now this line is providing attachment to some structure. So soleal line provides, so there is a fascia covering popliteus attaches to this. As the popliteus muscle is present above this, so it is like a blanket on top of it. Fascia, below you got the soleus. So fascia covering soleus. So both the fascias are attached to this line, and your soleus takes origin here. Soleus. That is why it is called as soleal line. And deep transverse fascia. This fascia we'll see when I do the leg, but remaining I can show you. Fascia covering the soleus, fascia covering the popliteus and soleus. Now the posterior above this, so posterior surface of the tibia is now subdivided by soleal line into your upper smaller area. So upper triangular area, you can see it is more or less, it is like a triangular area, and there is a lower large area. So rest of it is your large area. So this upper triangular area entirely it is providing your attachment to, insertion to your popliteus muscle. So this is giving attachment or insertion to your popliteus. This large area below the soleal line, it is further divided into medial and lateral by, you see there is one more line which is extending. This is what we call vertical ridge. So this will divide this into your lateral half, and this part we can call as a medial half area. So first, the posterior surface is divided by soleal line into upper triangular and lower large area. Upper triangular is giving insertion to the popliteus muscle, and lower large area is further divided by a vertical line into medial half and the lateral half. Now, if you now again look at this one, upper edge, somewhere here, upper part of it, you will find a nutrient foramen, and through this a nutrient artery will pass, which is we call the posterior tibial artery, because we are looking at the posterior part. So posterior tibial artery, it is a nutrient artery, is a branch of posterior tibial artery. So this is the largest nutrient artery in the whole body, largest nutrient artery in entire body. Now we will talk about the muscle which is attached to the medial and lateral. So there is a muscle which is attached to the lateral part, there is a muscle which is attached to the medial part. So to the medial part you have the muscle called flexor digitorum longus. So flexor digitorum longus, this attaches to the medial half of your lower larger area, whereas the lateral part you got the tibialis posterior. So here this is your tibialis posterior. So your tibialis posterior is to the lateral half. So you can see that after this the line is no more appearing, so thereby your lower area is again related to the structure. So there are so many structures are there, just like we have seen anteriorly from medial to lateral, which are there. So lower 1/4 of the posterior surface, here you have a retinaculum that we call flexor retinaculum. So these are all the structure from medial to lateral. So what do we have here? We got the popliteus muscle. So again I'll take another image and I'll try to do the same thing here. So there is a soleal line here, and that's a soleal line which is dividing into upper triangular area. Upper triangular area is giving insertion to your popliteus muscle above. The lower, this is the vertical line, you see, that's a vertical line where you don't see anything, divides into your medial half and the lateral half. So before that, the soleal line is providing attachment to the red line itself is your soleus muscle, and it is the fascia of the soleus, so which will come down because the muscle will go down like this, so it will form a blanket over it, and there will be one more fascia which goes up to cover this one. So that is a soleal line, and your medial half and lateral half you have the attachment. And I told you your lateral half you got the attachment, this entire big muscle what you had seen, which is from the interosseous membrane and partly from the fibula also. This is your tibialis posterior. Anterior was from the lateral surface. Posterior tibialis posterior is from the lateral half of your shaft of the tibia below the soleal line and corresponding interosseous membrane and some fibular head. Whereas the medial half is giving origin to your flexor digitorum longus muscle. This you see the lower part, you don't see any muscle here in the bone because this part is related to tendons, nerve and vessels. So what are the structure from medial to lateral if you go here? These are all the structure which will pass deeper to a retinaculum called flexor retinaculum. So there are tibialis posterior, then you have flexor, digitorum longus, posterior tibial artery, then there is a nerve called tibial nerve, and finally you have flexor hallucis. So in the front you have seen all where the extensors. There was a tibialis anterior, here is a tibialis posterior. There you had a extensor hallucis longus, here you have a flexor hallucis longus. There you had extensor digitorum longus, here we have flexor digitorum longus. There you had anterior tibial artery, here we have posterior tibial artery. There was a deep peroneal nerve, here we have a tibial nerve. This is from your medial to lateral, and easy way to remember is Tulsidas Amir Nahi. He was a poet, Tulsidas, if you can remember from your school days. So T for your tibialis posterior, D for your digitorum, flexor digitorum longus, A for your artery, posterior tibial artery, N for the nerve, that is your tibial nerve, and H for your hallucis, that is your flexor hallucis longus. So some of you may have a difficulty in remembering some Hindi, so then the other mnemonic could be the doctors are not hunters. So this is a little boring, but if it works for you, the doctors are not hunters. So this is again all about your posterior surface of the shaft of the tibia. So I can show all these things. Let us see in the app. So here we are trying to see now these structures. So we will see the soleal line. Above soleal line we will see popliteus. Okay. So behind we go, and let us see this. So here you can see that's your soleal line. So we are seeing, so that's your soleal line, which is dividing into upper triangular and lower. larger area. Now, so let us look at, so the upper area you have a muscle called Popliteus. So this muscle we can see now. So that's your Popliteus, which we have seen taken origin from your lateral epicondyle of the femur, passes through the groove. Here we see the lateral condyle of tibia, and now here it is lying above the soleal line. A triangular muscle, just like anconeus of your upper limb. Now, next, you see there is a soleal line itself is there. So this is the line which is giving attachment to soleus muscle. Other fascias and all are not shown here. I told you Popliteus fascia and soleus fascia also attaches. It's quite a bulky muscle, you see, soleus muscle. So this is, other part is also arising from the fibula. We'll see that in fibula, but right now this is the muscle. Yeah. So that's a soleus. It is called soleus muscle because it resembles the sole. Because in if you look at your plantar aspect of your foot, or there is a cloth which is there inside the shoe. So that if you remove, that is what we call insole. So it is resembling like a shoe sole. That is what is called as a sole-like, soleus. So not that Atma soul, that is not S-O-U-L, that is S-O-L-E. And then deeper to it you see the medial and lateral part, and you can see here there is a malleolus is below this side, so this is the medial half. So this one is your flexor digitorum. So this is your flexor digitorum muscle, and this muscle will be here. Here tibialis posterior, right? So this tibialis posterior, and here flexor digitorum longus. You see the lower part, both these tendons are going down there, so you will find this. So let us bring the structures here. Now here you can see these are the structure if you start. So this one is your tibialis posterior is hidden deeper to it, so I will be able to, now that's, you see, can you make out, it is more or less it is hidden, only tendon part. So you see it is highlighting, you can see the yellow thing which is glowing here down. Here you can see that is, the first is your tibialis posterior. So if I hide this, it is gone. Then you got the next tendon, flexor digitorum, hide, gone. Then you got the artery, this is posterior tibial artery, hide, gone. Then you got the nerve, this is the tibial nerve, hide, gone. And finally you have your one which is going to the thumb, great toe, this one. So it is called as a flexor hallucis longus. So hide, gone. So these are all the muscles Tulsidas Amir nahi hai, from medial to lateral in the lower 1/3 of the posterior surface of the shaft. Now, last part is the lower end of the tibia. So lower end. So we are done with the upper end, we are done with the shaft. Now we are doing the lower end of tibia. The lower end of the tibia, it presents here total 5 surfaces. So what are the surfaces? So it is your anterior surface, posterior surface, medial surface, lateral surface, it is like your radius lower end, and your inferior surface. So this will be your anterior surface of lower end, posterior, this is the posterior surface of lower end, then medial will be your malleolus, this is the medial surface, and same way will be lateral will be your fibular notch, that is your lateral surface, and this will be your inferior surface. So these are all the 5 surfaces. So as far as anterior surface is concerned, here it is upper part, here it is smooth, you can see here. So this anterior surface, the upper part is smooth, whereas your lower part, if you see, it is rough. And same thing if you look at the posterior surface. The posterior surface, you see the medial part of it. Posterior surface, this is your medial side, this is your lateral side. Medial part, you see there is a groove is there. So there is a, you see this one, there is a groove is there. Now this is a groove. What you see, this groove is made by the tendon of tibialis posterior. So posterior surface you will find a groove for the tibialis posterior tendon. Now if you look at the medial surface, so this is your medial surfaces, this is medial surface. Medial surface is actually subcutaneous and it is forming your medial malleolus. It continued down and form a medial malleolus. And then if you look at the lateral surface, so this is your lateral surface here. So lateral surface is forming a fibular notch. It is forming a fibular notch for your lower end of the fibula to form the inferior radioulnar joint, and it also provides attachment to the anterior margin and the posterior margin will provide attachment to the anterior and posterior. This is one ligament here and one ligament here of the lateral. So these ligaments are called anteriorly, it is called anterior Tibio Fibular ligament. Same thing on the posterior, it is called as a posterior Tibio Fibular ligament. So these are the ligaments of your ankle joint which are attached to the lateral surface of the lower end of the tibia. So now inferior surface, if you see, inferior surface is smooth. Let us see inferior surface. Yeah. And this is your inferior surface. Here you can see this is the inferior surface of tibia. This one, small picture in the diagram. This is the inferior surface. Now inferior surface of the tibia here is smooth and it will articulate with the body of the talus. So thereby it is forming your ankle joint. So this we call as a joint between the tibia and the talus, tibio-talar joint, tibio-talar part of ankle joint. So it is articulating with the talus, another bone which is the metatarsal bone. So this is about your, and so here what is very important is to talk about your medial more in detail. So that is your medial malleolus. It is important. So medial malleolus is it is the extension of your medial surface of the lower end. It has a tip. If you look at this, it has got a tip and it has got a surfaces. So parts of the malleolus are, it has a tip or you can call apex, and it has got surfaces. The surfaces are, there is a lateral surface, then there is a posterior surface, lateral surface, posterior surface. Yeah, these are the two surfaces we can see. So this is your tip. If you put a line, it is lying in the higher than the lateral. So if you join this both the level here, so here it is. So it is, I am not able to show here, but the tip is lying at a higher level. So that means it is shorter than. So that means you can see your medial malleolus is shorter than the lateral malleolus. So the tip lies at a higher level compared to your lateral malleolus. That means this is at a higher level. If it is at lower level, that will indicate a fracture has happened and the piece has gone down. So it is something like a stellate process of the radius and the ulna. So tip is lying at the higher level than the lateral malleolus, and this tip is providing attachment to. So your tip of the, so tip provides attachment to a very important ligament called as a deltoid ligament. We will see this later. So deltoid ligament is attached to the tip of the malleolus, that is your medial malleolus, the lateral surface. So now to see the lateral surface will be, which will be, this is your medial surface, which we already discussed. This is the lateral surface and this is the posterior surface. So let us bring some image here. Okay, so here you can see, so this is our medial malleolus. So this is your, this part, this is your lateral surface of medial malleolus. Now the lateral surface is, again it is smooth and it is comma shape, and because it is articulating with your body of the talus, medial surface of body of talus, this part. And posterior surface, so where is our posterior surface? So again we will bring the Yeah, this one is the posterior surface, and the posterior surface is providing a groove. Now you see there is a groove here on the posterior surface, and this groove is giving attachment to your flexor retinaculum. So flexor retinaculum of your leg, lower limb, attaches to this groove present on the posterior surface. Now, so what are the capsular attachment? Capsular attachments of, so capsule of the joint is attached to the upper end and lower end of tibia. So at upper end it is a knee joint capsule, and lower end it is here ankle joint capsule. So the upper end it is the margin of the tibial condyle, both. So you can just simply say it is the margins of tibial condyle. So that is, it attaches to medially, laterally, posteriorly, all of it. And anteriorly, here you got here, so anteriorly it is interrupted actually. So anteriorly it is interrupted by your medial and lateral. So they will attach to medial and lateral retinaculus, patellar retinaculus. So to this it is attached, along with your tibial tuberosity and tibial tubercle. And posteriorly, if you see, it is deficit, just like the capsule of shoulder joint, to allow tendon of Popliteus. So tendon of Popliteus passes, that is why there is some deficiency is there. So at the lower, this is all about this. So at the lower end of your tibia, for the ankle joint, if you see, so here it is just the margins of your, all the margins of articular surface of lower end, or articular surfaces of lower end. So that means all those 5 surfaces which I told you, to all this margin it will attach. So let us see this capsule. So now again, this is the last part, and this is that is, I am not able to, okay. It's not responding. It's become, I think it is sometime for some reason. Okay, anyway, so I'll go back. Now we'll look at the applied part of it. So applied anatomy. So mainly the infection here. So infection is osteomyelitis. So osteomyelitis is the bone infection. Later in the second year you will know in detail what type of infection, what are the features, but right now in the first year you can remember this as a bone infection called osteomyelitis. So osteomyelitis of the upper end of tibia is more common. It is common. And when this happens, again the knee joint is lying very close, but knee joint is not affected. This very knee joint remain unaffected. Now this is very interesting. It lies so close, but it is not getting affected. The reason, anatomical reason, is your capsule of knee joint is attached proximal. So this is attached to the proximal to your epiphyseal line. So this is epiphyseal line. Because of this reason, that means it is simple word is saying that it is actually little away from the area. That is why it is not involving. So I can show you an X-ray film. Not X-ray. This one is our MRI of infection. You can see. You see this is your upper end, showing the osteomyelitis. Here also osteomyelitis of the tibia. Here also you can see all going inside, deep inside. So that's your osteomyelitis. Another thing is the fractures are common. The fracture of tibia is also common. It is a weight bearing bone, and mainly the fractures are more common at the upper 2/3 and lower 1/3 junction of the shaft. Now why this? Because at this particular area the bone becomes narrow. Bone is narrow at this junction, so thereby being narrow and weight bearing, fractures are common. Especially, so thereby if this is your upper 2/3, this is the bone, and this is your upper 2/3 and this is the lower 1/3. So this is the fracture site. And very interestingly, at this point, again in this lower 1/3 area, this area, if any fractures are happening, this area is what we call as a bare area. The reason is, you might have seen in the anterior part I told you it is subcutaneous. So in the lateral part, lateral also we have seen it is subcutaneous. So thereby you don't have any much of the vessels are there. So here you have a low blood supply in this part. Because the muscles are not there, so the blood supply also is very minimal. Because of low blood supply, if any fractures are there in this lower 1/3, they are prone to go for late in the union. So we call delayed union of fracture, or sometime it may not unite also, so you call non-union of fractures. So this is about your all about your tibia. Hope you have followed things, and if you have any question, get back to me. So that's all for now. Take care, guys.